Here are 5 medical checkups, common after 70, that actually increase risk without improving outcomes. Number 2 will surprise you. Stop ordering that full body scan. It could cause the very cancer you're trying to prevent. Do you feel healthy, but still getting routine tests after 70? Those may be doing more harm than good, even causing 5% of all new cancers. Every year, millions of people over age 70 undergo routine medical tests, believing these exams will safeguard their health. But some of these screenings, those often recommended automatically, may actually increase the risk of surgery, strokes, and even cancer, rather than helping. Recent research shows that a significant portion of testing in seniors leads to unnecessary treatments, complications, or lifelong side effects. Shockingly, up to 37% of tests performed in older adults may cause more harm than benefit, yet most people over 70 are unaware they're being over-tested. Number 5. Bone density, DEXA, scan. A DEXA, dual energy X-ray absorptiometry, scan is a quick, painless exam that measures bone mineral density. It's widely used to detect osteoporosis or osteopenia, conditions linked to increased fracture risk. As screening tools go, the DEXA scan appears non-invasive, effortless, and reassuring for many older adults. However, in individuals over age 70, especially women, mild bone density reduction is incredibly common. Many seniors show T-scores classified as osteopenia, even if they've never had a fracture and remain active. This mild decline doesn't necessarily indicate a medical problem, it's often a natural part of the aging process. Yet once identified, it frequently triggers medication recommendations, even when no real risk exists. When osteopenia is flagged, doctors often prescribe bisphosphonate drugs to slow bone breakdown. While these medications have proven benefits in seniors with true osteoporosis or previous fractures, their advantages are far less clear in otherwise healthy older adults with only mild bone loss. Within this subgroup, the reduction in fracture risk due to bisphosphonate treatment may be minimal, approximately 0.3% over 5 years, according to conservative estimates. Yet patients exposed to these drugs risk side effects such as esophageal irritation or severe, though rare, complications like osteonecrosis of the jaw. Prolonged use can also lead to atypical femoral fractures, and the risk appears linked to duration of therapy. That said, bisphosphonates offer significant benefit when used correctly. In women aged 70 to 79 who already have osteoporosis or vertebral fractures, studies show meaningful reductions in hip and spine fracture risk. Guidelines recommend careful use, typically limited to 3 to 5 years, with reevaluation thereafter to avoid long-term side effects. For many older adults, especially those with only mild bone loss and no history of fractures, a lifestyle-focused strategy is safer and often more effective. Regular strength training, balance and weight-bearing exercises, e.g., resistance bands, Tai Chi, together with adequate calcium, 1,200 mg, and vitamin D, 800 IU, intake, can reduce fracture risk by 20% or more. These measures also improve balance, reduce falls, and help maintain muscle mass, offering multi-system benefits beyond bone health. In summary, while DEXA scans are harmless in isolation, their fallout for seniors can include unnecessary treatment or medication risks. When scans reveal mild decreases typical of natural aging, medications may offer minimal gains but significant downside. Instead, focusing on lifestyle interventions provides a low-risk, high-benefit path to maintaining bone health and reducing overall fracture risk. If you're over 70 and your DEXA shows mild osteopenia, but you've never broken a bone, remain active, and have no major risk factors, ask your doctor whether treatment is really necessary or if a lifestyle-first approach may be safer. Number 4. Brain MRI for mild memory loss. When someone over age 70 mentions occasional forgetfulness or minor confusion, doctors often recommend a brain MRI to check for serious conditions like dementia or brain tumors. Since MRI creates highly detailed images of the brain, it seems like a sensible, precautionary step. Yet in most cases, what these scans reveal is far less alarming. In the aging brain, it's extremely common to see subtle changes on MRI, things like white matter spots or mild shrinkage. These findings, known as white matter hyperintensities, are usually harmless and reflect normal wear and tear rather than disease. In fact, studies show that the vast majority of seniors, often more than 80%, display such changes on imaging, while very few actually have conditions that require medical treatment. Still, once such findings appear on a radiologist report, they often trigger further testing. Some patients undergo lumbar punctures, exploratory biopsies, or other invasive procedures based solely on these incidental findings. Yet true medical conditions that need intervention are detected in only a tiny fraction, sometimes around 3% of cases. In contrast, a much larger group may endure anxiety, unnecessary discomfort, and potential harm from follow-up procedures that seldom help with memory or cognitive decline. For older adults experiencing only mild, non-disabling memory changes, and without alarming symptoms such as seizures, rapid personality shifts, or functional decline, a brain MRI usually doesn't add meaningful insight. Instead, it may trigger a cascade of worry and medical testing without changing outcomes for the patient. A much better first step is a standardized cognitive assessment, simple tests that evaluate memory, attention, problem-solving, and daily function. These tools offer a practical, non-invasive way to determine whether memory worries are within normal bounds. If screening identifies real concern, then targeted imaging may be justified, guided by clinical symptoms, not routine scans. Ultimately, while brain MRI is a powerful diagnostic tool, it often uncovers findings that are part of aging, not illness. In seniors with only mild forgetfulness and no neurological warning signs, the safest and most effective approach is clinical evaluation, thoughtful monitoring, and lifestyle support, not immediate scanning. Number 3. Cardiac stress test in asymptomatic seniors. When older adults without clear heart disease symptoms, like chest pain, shortness of breath, or pronounced fatigue, undergo cardiac stress tests, the results often raise false alarms. These tests were originally designed to detect serious heart problems under stress. But in seniors who feel generally healthy, up to nearly 40% of results can be falsely positive, meaning the test indicates possible heart disease when none exists. These misleading results frequently lead to invasive follow-up procedures. Patients may be referred for angiograms, stent placements, or even bypass surgery, all major interventions that carry their own risks. Studies have shown that in asymptomatic seniors, these procedures do not significantly improve survival or enhance quality of life. Instead, they expose patients to complications such as bleeding, kidney injury from contrast dye, and extended hospital stays, often without benefit. Furthermore, the accuracy of stress tests declines in low-risk populations. In older adults who present little to no suspicion of heart disease, a positive test result often leads to more harm than helpful insight. In such cases, non-invasive and low-risk alternatives exist, like resting electrocardiograms, EKG, and coronary artery calcium, CAC, scans. These measures help assess cardiovascular risk without pushing patients toward potentially unnecessary interventions. CAC scans, in particular, use a quick CT scan to detect calcium buildup in coronary arteries and generate a risk score. A score of 0 often corresponds to a very low risk of heart attack in the next few years, potentially sparing the individual from medications or further testing. When used appropriately, these scans help guide decisions more safely than stress tests in asymptomatic older adults. In summary, stress testing in seniors who do not exhibit clear cardiac symptoms often produces misleading results and may trigger unnecessary procedures with real potential for harm. Instead, beginning with careful evaluation, such as EKGs or calcium scoring, and considering risk factors and clinical history offers a safer, smarter approach. Number 2. Colonoscopy after age 75. As individuals move past age 75, the balance of benefits versus harms shifts significantly when considering routine colonoscopies. While colonoscopy is a vital screening tool earlier in life, its risks increase with age. Older adults are more likely to encounter issues with the bowel preparation, such as dehydration or electrolyte imbalance, and may also be more vulnerable to complications during sedation due to underlying health conditions. In older seniors, serious complications from colonoscopy become more common. Clinical data show that for every 1,000 procedures, over 20 seniors aged 75 or older may experience major adverse events, while only around 2 lives are saved by cancer detection in that age group. This yields an approximate risk-to-benefit ratio of 10:1. Many of the growths found during these procedures are small, slow-growing polyps that may not impact lifespan, and their removal can itself introduce additional dangers. Common complications in seniors include perforation of the colon, bleeding, and cardiovascular or respiratory problems during the procedure. The required bowel prep, involving strong laxatives and fasting, can strain the kidneys or cause low blood pressure. issues that become riskier with advancing age and coexisting medical conditions. For older adults with a history of negative colonoscopies and no symptoms, a home-based stool test, FIT, offers a non-invasive and practical alternative. FIT requires no bowel prep, no sedation, and can still detect hidden blood in the stool, triggering colonoscopy only if results are positive. It is a safer, simpler option that avoids unnecessary risk in well-screened seniors. Ultimately, in asymptomatic individuals over 75 with solid screening history and reasonable health, routine colonoscopy generally carries greater potential for harm than benefit. Decisions about screening past this age should be personalized, taking into account overall health, prior testing history, and life expectancy. When appropriate, stool-based testing can be a better choice compared to unnecessary repeat colonoscopies. Number 1. Annual full-body CT scans. Full-body CT scans are increasingly marketed as comprehensive health checkups, promising early detection of various conditions. However, for seniors without symptoms, these scans often pose more risks than benefits. A single full-body CT scan exposes the body to approximately 10 to 20 millisieverts, MSV, of radiation, equivalent to about 500 chest X-rays. While the risk of developing cancer from a single scan is low, the cumulative effect of repeated exposure can increase the risk over time. Studies have shown that the radiation from CT scans may be associated with a small increase in the possibility of developing cancer later in life. The benefits of full-body CT scans in asymptomatic individuals are minimal. These scans often detect incidental findings, such as small nodules or lesions, that are benign and would not have caused harm if left undetected. This can lead to unnecessary follow-up tests, biopsies, and procedures, which carry their own risks and can cause undue stress and anxiety. For seniors, especially those over 70 or with existing health conditions, the risks associated with full-body CT scans often outweigh the potential benefits. Instead of routine full-body scans, it's advisable to undergo targeted screenings based on individual risk factors and symptoms. Consulting with a healthcare provider can help determine the most appropriate and safe approach to health monitoring. In summary, while full-body CT scans may seem appealing as a proactive health measure, they often lead to unnecessary procedures and increased radiation exposure without proven benefits for asymptomatic seniors. Opting for more targeted and evidence-based screening methods is a safer and more effective strategy. Modern medicine is powerful, but not perfect. Sometimes less is more, especially past age 70. Before agreeing to a test, ask, what happens if the test is positive? Could it trigger another test or treatment? Do I really need it, or is lifestyle management a safer and more effective alternative? Real prevention starts with movement, nutrition, sleep, hydration, and wisdom, not fear. We'd love to hear from you. Have you or someone you love experienced complications from a medical test or treatment that turned out to be unnecessary? Share your story below, and let's support each other. Thanks for watching, and take care of your health.